What would a victory for the feminist movement look like, or your view of feminism? Like
what's my view of feminism?
Yes, or
okay.
like what is an injustice or something wrong in America that you would like to see remedied or cured with your view of feminism?
Okay, I can get real specific with it. I work in the healthcare field, and I see a lot of inequality within that. So that's one way where I'm a feminist, where I can see, okay, women aren't being treated the best way within the healthcare field specifically. They don't have the same rights as a man does.
Wait, can you elaborate on that?
Do you mean patients or the
patients?
employees?
Yeah.
Okay.
Wait, can you elaborate what you mean? Like, what is the inequality?
Patient care, a man as a patient versus a woman as a patient, very different.
Can you articulate it a little further?
Women don't have the same care as a man.
Isn't it the case that women see doctors more frequently? They get more. They're more likely to go visit a doctor.
Yeah, that's 100% the case. But that's because they're not getting adequate care. That's why they have to keep seeing new specialists, new people.
Wait. I don't think that's the reason. I think women just tend to care about our bodies, and men only care when they're on their deathbed. That's like the typical reasoning.
Women, like for like Medi-Cal or whatever. I don't know what it's called.
The reimbursables for women are like 7 to 1.
They're more likely to use.
Especially under 50 women.
But it's taken me like 6 months just to get a checkup, like just.
I don't think that's because you're
standard.
a woman, though.
You don't think so? Okay.
I think that. Why would it be because you're a woman?
I don't know. Maybe because women's health care is harder to get. I'm not sure. That's
so
just
you're talking
me
like your
shooting in the dark.
OBGYN?
No, just primary care physician.
Why would
actually.
Why would that be because you're a woman, though?
It actually might be because I have shitty health care.
It also could be because we're just brought a couple million people from the third world into this country.
Yeah.
That
kind of creates long lines, but that's a separate issue.
Well, could you elaborate a little further on the healthcare thing, though?
Do you want me to just keep going, listing examples?
Well, you said women have, I don't know if you said rights, like women have X that men don't.
Yeah, women are behind in the healthcare field. So that's something I would want to see women progress in.
Like in nursing?
No, as a patient. I've made that clear.
Oh, as patients?
Yes.
How are they behind?
A woman doesn't get the same adequate care from her primary doctor, from her specialist, from whatever person that a man would, and that's been statistically proven. I'm in the healthcare field. I see this firsthand. I'm told about this by my coworkers, by my actual patients, by the people I work with. So that's just my experience. So you asked me for a specific example about feminism, and that's what I gave you.
So what would solve that?
Honestly, I'm not an expert within the healthcare field to be able to say you need to do this, this, and that. But I just believe that there is something that could be done.
Do you think that women sometimes might be overemphasizing a condition that might not be a big deal?
No, I don't think so. I mean, yeah, possibly person to person. There's many women who could do that. There's many men who would do that. How is that relevant?
No, because the survey you're citing is that women think they're not getting the care that they deserve, when I think they actually are, and then some. But you're right, men will not go to the doctor unless they're missing a limb, where a woman will call their doctor as soon as they have a sniffle or a sneeze or a cough. And so they engage in the healthcare system more often. So when you have more interactions and more touch points, you'll have more people who think that there's an injustice when there really isn't.
I see your point.
And you also, well, actually, here, we'll come back to that a little bit. I did also want to get an answer from you really quick on the draft thing, then we'll move it along to a different topic. You said you're a feminist, but not in favor of women being drafted. How do you reconcile that?
I mean, I think that there should definitely... I think there should be definitely things that are more, or I guess not more important, but like, I'm more for like, if I'm working a job in a lab and a man is working a job in the same lab and we're doing the same things, then we should be getting equal pay. But
what if you work harder than him? Should you get more money?
Well, what do you mean, like work harder?
Put in more hours, show up earlier?
I mean, wouldn't I...
What if you're better than him?
Then they would probably recognize the hard work that
But I thought you said equal pay.
I mean, I think it would depend on like your lab position. And like how high.
But you have the same title. Do you want it to be based on merit or just equality no matter what?
I mean, I guess like if you are working harder, then I feel like you should get paid more regardless if you're a man or a woman.
So men are more likely to show up early at work. They're more likely to not take 7 to 10 years off for having a child, whether you like that or not. More likely to ask for a promotion, more likely to ask for a raise. They're also more likely to get their boss to notice their hard work. They're better at that than women. So maybe it's not that women are getting paid less than men.